YouTube, you know, right? Just type Vamsi MLE, that's it. Then I will be there. Anyway, let me take a class. So first I will discuss about ethics, then we will discuss national healthcare delivery. And keep in mind, I got very less classes for your MST 1 exam. Already these two classes has been, I lost these two classes. Last time on Monday we got one function, and this tomorrow I have another class, but tomorrow we know it's a holiday. So that's why go with the weekend work 2.0. I already shared with you. So 1.0, 2.0 and 3.0. There will be 3 weekend works, and these 3 weekend works will cover all first unit topics. Is it clear? Start self-reading yourself, and I will be guide you, and I will provide you all the notes. And the subject is very easy to my knowledge. Only primary healthcare delivery, secondary and tertiary, starting from municipalities, healthcare workers, community involvements, and the difference between government sector and private sector, and difference between national healthcare delivery and foreign healthcare delivery, or developed countries healthcare delivery. So these are the major topics, all are easy. You just read once. If you have doubts, you can ask me and I will guide you. Is it clear? Yeah. Then, actually I like ethics, that's why I want to take ethics class, more over this one. This is more like, bookish knowledge. That's what I was concerning. Anyway, so what are ethics? What do you mean by ethics? Can anyone say? Why ethics are important? Can anyone define ethics, by the way? Yes, miss.
These are the morals and values that guide healthcare workers when making decisions.
By the way, don't see any textbooks, don't see any internet. Just to say what you know, that's it. It should be like a one-on-one interaction.
Moral values.
Yeah. So ethics means what do you mean by ethics?
Moral values.
Moral values. So I want to write everything here. She said moral values. Then? Yes.
Rights.
Rights. Oh, she said rights. Then? Yes. Responsibilities. Okay, responsibilities. Next. Any other terms that you know about ethics? Rules and regulations. Law. Then, yes. Principles. She said principles. Okay, then? Belief. Oh, okay. Belief. Belief. Okay, next. Next. Any other words for ethics? Now listen. Whatever you said, all are different. Morals are different. Rights are different. Values are different. I want to write morals and values. They both are different. How these things are different from ethics? Okay. Try to understand. What do you mean by moral? What is the meaning of a moral? Morality or morals. So listen. Everyone pay attention to the class. Last bench, don't talk. Listen. Where does we encounter the word moral? Do you heard about morals any time before? So after reading any story, what is the ending of the story? That is morals, right? So what is the meaning of moral there? Yeah. Listen, morals means the lessons that we learn. Okay, we personally will learn it by someone teaching us, maybe like stories. After listening to the story, we understood. Our perception about the story, our summary, or our view of something we learn can be stated as a moral. So morals cannot be like a punishment. What is the punishment? You already did a mistake, so you got punishable. So mistake is different from morals. Morals will be understandable without getting actual scenario. That can be said as a morals. Like story, conclusion of a story will be a moral, right? So that is morals. Then what are values means? How morals are different from values? What are values? What do you mean by value? Not currency. Social, yes. Philosophical definition, yes.
Something that is important.
Huh?
Pertinent.
So listen, values means a set of guidelines given by a particular community. Values means set of guidelines given by particular community can be stated as values. Now listen, values will change from place to place. Why I am saying values are not universal, they will change from place to place. If you live in Punjab, Punjab has their own specific cultural values, right? If you are going to temple, you should not wear, sandals. Then you should cover your head. So there are certain values that need to be followed, and these values will change from place to place, right? So they are called as values. So now you understood what are values. These are certain guidelines given by particular community, or values are localized. The same values that are present in Punjab might be different in Andhra Pradesh, or Saudi values present in a Muslim dominated country, the values might be different from Christian dominated country. So values are changing from place to place, and that is not a right practice. That means when I say right practice, they are not universal. We need something that is universally acceptable, something that is common to every one of us, and values are not one of them. Got my point? I am not demotivating, I am just telling a generalized statements. So morals, personal experience upon learning a story without self-punishment, whereas values, something that is localized, that are principles given by a local governing bodies. They are called as values. Then what are responsibilities? So that is a self-responsibilities based on your job criteria. Based on your actions, responsibilities will change, right? So as a student you have some responsibilities, as a faculty I have responsibilities, and these responsibilities will change from our position. When I say position, at what context we are appearing to the second person. To my parents, my responsibilities will be like a child, right? A son to the parents. To my son, it will be like a father. So the responsibilities will change. They are not universal, but I hope you understood what are responsibilities. Responsibilities are not ethics. That is what I want to try to convey. Moralities are not ethics, values are not ethics, and even responsibilities are not ethics. Okay? Next, fourth one, rules and regulations. So rules and regulations are like a dictatorial. So if someone said these are the rules, blindly you must follow the rules. That's it. There is no more, argument. So rules are a set of guidelines given by a set of governing bodies. Rules in this university, rules to the government, rules. Got it? So even rules are localized and they are not universal. I hope you understood what are rules. Then next one, law. How law is different from ethics? Can anyone define what is law? Yes. So judicial law, I am not telling about scientific laws. See, you should not stare at your books, right? When I am teaching you, you should listen to me. That is the way of respecting me, right? So don't use mobiles, don't write anything. What is the practitioner doing there? You are beside. Pay attention to me, don't use mobile. Are you listening to me? Then why are you staring down? Everyone must stare to me, okay? That indicates your listening ability, right? Or at least that is how I will evaluate you. So don't make me sad by not listening to me. Anyway, where am I? Law.
No.
So what do you mean by a judicial law? So law is always associated with the government. Okay? If you not law are certain rules and regulations given by a governing body, and if you go against a law, you are punishable by default. You are punishable by default if you are against the law. So law is a framework of certain rules, together stated as a law, and if you violate a law, you will be punishable legally. legally you will be punishable. That is called as law. Law is always connected with a punishment governed by a government. That is called as law, right? Next one. So law is not a universal. Again, there are issues, right? Eating cow is seen in one place and in other place, that is good. So that changes. Yeah, law. Next one, principles. What do you mean by principles? Yeah. What are principles? Yes. Any idea? Can you give me any normal usage of principle where we are using in a regular daily life? Like principles of any one deity. These are the principles to reach to that deity, right? The way of living, right? Principles by Vivekananda, principles by Bhagavad Gita, principles by Quran, principles by Bible, right? So principles again looking like a dictatorial way. Again they are commanding us. Okay, maybe principles are guiding us to reach one particular domain. Principles are a step of things to reach to one particular domain. If you take a principles of Quran, you become a pure deity of Allah. If you take the principles of Bible, you become a pure deity of Christian, right? Or Jesus. So principles are a set of guidelines that will take us to a particular goal. Okay, they are called as principles. So principles giving us a pathway. That is called as principles. See, all are very different. Initially you thought everything same. Right. Next, belief. Belief is entirely different story. Okay, that depends on your personal perception. I believe she is good. I believe she is bad, and that might be perception is only to me, right? Same thing for faith. I have faith on her. These things are not universal, right? So now we have understood the problems with various wordings or various approaches of these things. We don't want these things. We need something that is universal, that is universally acceptable. Got it? So we can't obey all these things. All these things are dictatorial way, right? Dictatorship way. So what to do? Now I will give you one challenging situation. Imagine none of the religion, none of the anything have never stated to kill a next person. Am I correct? Don't hurt anyone. This is the statement of everyone. Every religion, every belief, every principles. Am I correct? If you kill someone, you are making a mistake, you are sin, and you are punishable. Am I correct? No. I will give you a challenging situation. The situation is the train story. You already know the train problem, right? Listen, this is a train. This train going to a route and it is diverting into two tracks. In one track, one person was trapped, and in another track, 100 persons are there. And you are standing here, and you can divert this train only to one way, but you can't stop the train. Either you will divert train to this track or this track. What you will do in this situation? This is one of challenging paradox. You are in a position where you need to guide the train either to this way or this way. What you will do? Or you won't do anything?
Why are we going?
Yes. If you are not doing anything, then at the time train will crash and train carrying 10,000 people. Or now tell me what you will do.
Sorry.
Yes.
Can I ask? The people, are they?
Liver, whatever.
They are what? They are on the train tracks or they are on the podium?
They are properly on train track. Someone, stitched them. Someone, glued them to the track. If train goes, they will become two pieces or four pieces.
Oh, okay.
So what you will do in this situation?
Yeah.
Yeah.
You guide the
You are
train.
a believer, you are a faith, you are the best of best. And you are in this position. What you will do? You are not criminals, you are not psychos, you are good people, by the way. Now tell me the answer. Yes. You are not psychopaths.
It can't stop.
The train can't stop, right? So I would divert it to the route where
So,
there is one person.
You will kill this person, right?
Yes.
Yeah. So she is saying she wants to be a volunteer murder for one person. She wants to kill one person. And she is happy for that. Whatever ethic, what these things say, never kill a person at any instant. But now you took a decision to kill this person. So can I punish you by law? Because she killed one person.
No.
I cannot punish her.
No. Because she saved a lot of people.
By law they say, by law I can punish her. Yes. By law I can punish her because she
But
killed a person.
it's a good
An
deed.
innocent person. Yeah. So what is your idea? What is your... So one person, she is very firmly attached with the law. So she is saying, even though she has a good intention, she must be imprisoned in the jail for next 50 years. Goodbye. I'm sorry. As per her. What to do? Any other suggestions? Yes.
I'll tell that person to move
Huh?
away.
The person
tell
is
the
the
person.
person is
Yeah,
obsessed.
you can't save them.
Yeah.
Listen. Now you understood the paradox, right? See, this is the same problem even the law is facing. The law knows, yes, you should not kill, but she killed for a good intention.
Yes.
What to do? At this situation, we will approach someone, and that someone is called as ethics. Under what circumstance she has taken decision of killing one person? If she justify the reason of her killing, and if it is in compilation with the ethical standards, she will be a good person. Now we will take this matter to the ethics, and I will give you the definition of ethics. Ethics are certain rules that will define us from good and bad. They will guide us to know what is good and what is bad. Ethics are always for the good intention. And the ethics main principle was do no harm. At any cost, you should not harm anyone. If you are going to harm, harm the most minimal way. See? Got it? Ethics trying to say that, ethics will say whether your act was good or bad. From ethical stand of view, her decision was good. Because she is saving 1,000 lives by sacrificing one person. So ethically she is correct. By law, we might punish, but by ethics, we are not going to punish her. Because why? Because law approached ethics, and ethics say this is a good decision. Got it? And there is a minimal that is loss of only one life. Right? That is the guidelines of ethics, simply. I hope now you understood what are ethics. Right? So now, how we can use ethics in medical care, health care? What is the use of ethics in health care? I want to give you some very interesting analogies. This class is still 11:30, right? But there are very interesting things. Anyway, listen. So there are 5 principles of ethics. Everyone write down the 5 principles of ethics. Very interesting things. 5 principles of ethics. Actually, I didn't prepare for this class, but suddenly I came to know this is ethics. So I was, now this became my favorite subject. Anyway, write down. The 5 principles of ethics are A, B, C, D, J. Simple to memorize.
It's what?
5 principles of ethics are A, B, C, D, J. ABCD. Okay, what are those? I will let you know. Okay, 5 principles of ethics in healthcare or overall. Listen, A stands for autonomy, B stands for beneficence, C stands for confidentiality, and D stands for do no harm, and J stands for justice. So what are these? I will let you know. Write down ABCDJ. Autonomy, beneficence, confidentiality, do no harm, justice. Okay? Now listen. Very, very interesting things. Is everyone listening? Yes, Mr. Last bench listening, right? Yes. Take notes, okay, meanwhile. Listen, what is autonomy? So ethics always says one important thing. Listen everyone. Ethics says autonomy is the first principle of ethics. What is autonomy means? Any idea what is autonomy means? Listen. Every individual has their own right to take decisions. Every individual has their own rights to take their own decisions. Got it? That is called as autonomy. Right to individuality. Right of individuality is called as autonomy. Right of individuality is called as autonomy. That means she has complete freedom to take her own decisions. He has a Daniel, right? Mr. Daniel has his own rights to take his own decision. Even Alfred Nobel, okay. Actually, Alfred Nobel discovered bomb to kill everyone, but eventually he became the best scientist. He started giving Alfred, right? Listen. Now, this is called as autonomy. How autonomy is practically implemented in healthcare. Now listen. She came to my lab. Okay. Now, I'm going to take a blood from her. I need to insert a needle. Okay. Can I manhandle her?
No.
Obviously, every one of us are fear of needles, and needles are painful, right? I need to give an injection to her.
Yeah.
Now, with my good intention, ethically, she denied. She don't want injection, and she is shouting on me. Don't give me injection. Now, I'm saying, "Arey, you will die. Let me take it. Can I give injection to her forcefully?"
No.
I'm trying to justify my thing. I'm trying to save you, and I manhandled her to give the injection. Is that a right approach?
No.
Okay. So it's not a right approach. So what is the right approach? Informed consent. First, I should explain her. Miss Ma'am, I'm going to introduce this needle, and it will be slightly painful. Are you ready? If she said she don't want injection, I need to seek an alternate to treat her.
Yes.
Respecting her autonomy. Got it? This is called as autonomy. Every patient has right of taking his decisions. Okay? Now, let us see another situation. Okay? If I don't have an alternate approach, what I should do? Only injection is a way of treating her. What should I do now? Yes.
You should try to calm her down and...
Yeah, I must counsel her.
Yes.
Miss Ma'am, please try to understand there is no other option. I need to brainwash her. There is no other option. Brainwash is not a right word. Counseling. A technically correct word. I will counsel her. Now, third situation. My patient was in coma. She is not able to, she can't listen. At this situation, what should I do? Can I directly give injection to a coma patient? Unconscious patient? That is against autonomy again. None of us likes to touch our body, by the way. What should I do in this case? I got a patient who is unconscious.
Don't you get consent from the family?
Yeah, next to the kin.
Yeah.
Next to the kin. Apart from patient, see, if patient is unconscious, definitely an unconscious patient cannot come to lab.
Yeah.
Someone brought her. So we should take permission from the second person. Next to the kin means apart from the second, guardian. So upon guardian permission, we can treat her. Got it? Yeah. Same thing for children. Children has an issue. None of the children will like to give, take injections. Parents will be the next to the kid. If patient parent is ready, he will go. Okay. Anyway, that is. Now I will give very interesting thing. That is fourth challenge. Now, our patient is a Supreme Court judge by profession. So he know all these things. So he has some issues with his wife. Okay. And what he did, he was trying to commit suicide. So he took 100 sleeping pills. Okay. Now, what he did was, before taking sleeping pills, he took a permanent marker, maybe tattoo, and he wrote on his body. You know what he wrote? Don't treat me, on his chest. And he took the sleeping pills. Okay. And he collapsed. Now his wife brought the husband to the hospital. Now, as a doctor, what you will do? First, you will see the patient, and patient literally wrote on his chest that don't treat me. Are you going to respect his autonomy now?
No.
No. What you will do?
If the wife says treat him, you will treat
yes.
him.
Now I will let you know. Now what wife said is, "Arey chhod do yaar, let him die." What you will do now?
You will let him die.
Now wife also said, "Let him die. He's tortured me this long. Now let him die. This is punishment." What you will do now? Yes. So you will respect wife's decision. And then what you will do? Whom's autonomy you will see. See, this is a challenge to the ethics now. Listen, very simple. You can bypass everything. As a healthcare professional, what is your first right? To treat a patient. And you will take the first principle of your profession. You can bypass everyone and you can treat the patient. And legally you will be on safe side. Yes.
But sir, let's say the patient...
Because see, ethics always says at any instant, don't harm anyone.
Yes. But if the patient recovers and then he sues you for going against his decision,
now
what happens?
the law will protect us.
But the law will tell you, that he wrote on himself that you...
That is why, that is called as ethics. Ethics are something that will be, there will be a panel discussion and they will take the collective decision. Yeah, ethics is not a one person, it's a panel discussion. Now listen, this is my favorite problem. Imagine one person really torturing you, your brutal enemy, okay? You want to kill that person, but you are unable to murder him because you are a good person by society. So one day what happened? So there is some unconscious patient in the next ward. You went there, and by seeing the patient, you become, yes, this is the time. That is your brutal enemy. What you will do now? This is your time. Now they will say every dog will get time, now you want that time because your patient, your enemy became your patient. Okay? Yes. This is the important thing. That is what the ethics is all about. Okay? Even at subconscious level. Ethics are the decisions taken at subconscious level without any supervision. What is your actions? What are your decisions at subconscious level? Okay? And that is all about ethics. Clear? And this is about autonomy of ethics. Then next one is beneficials. What is the time? Actual correct time?
6 minutes past.
Oh, 4 minutes left. Shall I continue or shall I stop?
Continue.
Oh, so I have to respect your autonomy. Anyway, beneficials, maybe I'll finish in 2 minutes. Okay, quick. Beneficials, listen. So, you got two patients into the lab. Anil Ambani came, richest person in India. Okay. Anil Ambani came with a hand in hand. His hand was cutted, amputated, and he came with a hand in hand. Okay. His first hand in his second hand, he came right into the hospital. And second one, a beggar came. Okay, beggar came and he said he has a fever. Whom you will treat first? Anil Ambani is ready to pay you $1 billion, by the way. Whom you will treat first?
The one with money.
Yeah. The one who came first. Oh.
Yeah.
So Becker came first and Ambani came second. Are you going to treat Becker first?
Yes.
Yes. Okay.
Yes.
And Anil Ambani gave you 1 million. Whom you will treat?
The one that came first.
Listen.
What's it?
I was discussing about justice, not beneficence. Listen. You need to treat Ambani first, not because of money, because of the severity. Who is going to die first? Is a beggar with a simple fever, or is an Ambani with gonna die because of bleeding? Okay. Ambani is bleeding here, even though he is a multi-billionaire. So it is not about the patient's economical background or a racial, economical, financial, anything. It is about the priority.
Yeah.
Who will die first? The first one who will die, you need to treat them first. That's it. That is called as justice. Okay. Then beneficiaries. Whatever you are doing, everyone must get benefited. It should not be like specifically to this race, this caste, this community, this color. Like this, okay? Everyone must get benefited out of it. And the most important aspect is your confidentiality. Keep in mind, patient always coming in unconscious state, and you need to respect patient's confidentiality. His data is everything, right? Sometimes patient is unconscious, that doesn't mean you can take photos or whatever you can, and patients get up. And last and final, AIDS is one of the problematic condition, and AIDS always looks at severe pain, but the patient with AIDS will die after 40 years. But patient will get more societal blaming. You got AIDS, maybe you did wrong practice. Because of that societal blaming, due to this emotional pain, patient will die, not because of AIDS. Okay. So at any cost, we should not review patient data even to the next colleague or to even home persons also. Always we should maintain patient data confidential. Say for example, some Mahuti caution came for blood sample and we get he has HIV positive. Are you going to tell to the paparazzi or to the media? Never. That is something very private, right? Confidential. So confidentiality plays a vital role. And Rasha final do no harm. I hope you already know. At any cost, you should not harm the patient. These are the 5 principles of ethics. Thank you so much.
Thank you.
Yes.